Now, what are the things? See, you have to be very, very target, specific. Whatever you do on earth, you have to write a schedule of your own way. I will hear song, music at 6 p.m. Right. You have to reset your clock, your biological clock, and also don't read 1 day, 2 days you're reading up to 2 p.m. or 2 a.m. You're reading, and 2 classes are bunked. Or you're rushing for a breakfast. Without breakfast, you're rushing to the class. Don't do it. आपका क्लास का जो क्लास होगा, complete that side by side. You just sit here. 15 minutes. I told you again. এখানে বসে তুমি যতক্ষণ না ছাড়বে ততক্ষণ ওরা তাগদা দেবে না। তুমি তখন এই স্পেসিমেন গুলোকে ভালো করে দেখে নাও। Go home and after 10 p.m. 6 to 10 you do your physiology biochemistry. Ever one day you might be not in the thing, you have a test next day. So you stress for 2 hours or 3 hours for physiology or biochemistry or anatomy. You study in groups or 2 roommate. ঠিক আছে? And I think this food is not bad. It is, these vegetables are grown here, there is no pesticides and this thing, organic vegetables. कुछ शाक मिलेगा, कोई एक दिन चिकन मिलता है आपको, फिश मिलता है, अंडा, है? 4 times? 4 days. Oh, 4 days you're getting chicken. Then chicken to kya hoga? And 3 days you take veg, and 1 day you go out and take biryani or whatever it is. Now, everything you have to maintain nutrition and your thing. Now, I'm being focused. I was out of focus now. One thing, I was out of focus. I was out of focus for 2 minutes. Now, I'm telling you why you target, you be specific. Now, identify side, external features and relation of structures which form the root of the lung and bronchial tree and their clinical correlation. Mention blood supply, lymphatic drainage and nerve supply of the lung. Now, now you see the thoracic cage, the lungs, here lung, the pleura, here this is the cupula. Cupula I told you in your lecture. Now, describe the right lung under the following headings: borders, surfaces, fissures, lobes, impression and applied anatomy. Lungs or pulmons, vital organs of respiration, situated in the thoracic cavity, covered by pleural sac. Main functions of lung: oxygenation of blood, gaseous exchange. Space between the right and the left pleural sac is mediastinum. Note korbe na, beshi note korbe na, just ekta duto. You just because the whole thing lecture, if you go to make a note, you don't have concentration on the slides. Then when you go home, you have your book, you have your khata, and then you one point main thing, the question. What are you likhne? ঠিক আছে? Now, the features of right lungs. 2 lungs are there, and right and left, shape pyramidal, conical. Weight, right lung 700 grams, slightly heavier than the left lung, 650 grams. Color rosy pink. On exposure, pollution and smoke, lungs become brown and black. Now texture, spongy. You go to a mutton shop or a chicken shop and ask them for a lung. Feel it, red, pink. I'm talking about the color, and you feel the consistency. Over here you will feel the consistency same, spongy. Okay. Now it is covered. Why it is covered by a pleura and this thing I told you there. Also I am repeating it that it reduces the friction because it is in the thoracic cage, bony structures that is lined by pleura. Also the intercostal muscles are there and these constitute see, now this is the apex, this is the lingula, this is the oblique fissure in the left lung, this is the inferior border and this is the cardiac notch, this is the cardiac notch, this is the posterior border. Okay, now horizontal fissure is there, this is the oblique fissure, this is the base of this and this is the anterior border. So 1, 2, 3 lobes. This is 2 lobes. So whenever you are erokom examination thakbe, I am here sitting, examiner. Pick up. Then you can pick up right, you can pick up left. Okay, any lung. When you pick up, you please see the impression and all this. Main thing you have to see the fissures. That lung has 3 lobes. Right lung, left lung, 2 lobes. And in between the 2 lungs, the heart is placed in this cardiac notch, this place. This is the trachea. Now, now clinical integration, this is important, means in MCQ or your lung flow test, short note. Dosimecia, lung flow test, note. Now, after autopsy, lung kept in the bucket of water, individual who has taken breath, air present in the lung alveoli and such lungs float in water. Now, test useful in forensic medicine differentiates stillborn from liveborn babies. Fetus and stillborn babies without signs of life, lungs sink in water, whereas in liveborn babies, lungs float. So, if the baby is stillborn, then your lung sinks in water, whereas in liveborn babies, lungs float. Because sometimes see premature delivery. Premature delivery, it can be 16 weeks, 14 weeks, it can be on 22 weeks, on sometimes full term. So, this if it's done in an autopsy, the 2 fetuses is found in this garden. Someone came and threw it in a bag. So, was it living or was it a dead baby? So, this is now apex blunt lies in the root of the neck, base concave rests on the diaphragm, borders anterior thin cardiac notch on the left, posterior round in ill-defined inferior semilunar, costal surface smooth, convex, related to the ribs and anterior mediastinal part, posterior vertebral part, inferior diaphragmatic part. Now, features of the external features, again apex, base. Base is lower concave surface, three borders, anterior, posterior, and inferior. Two surfaces, costal and mediastinum. Fissures, horizontal and oblique on right, only oblique in left. Lobes on right, superior, middle, and inferior, and on left, superior and inferior. Okay. You just imagine, this heart is not this lungs, this body is, but I'm just saying it is like this. Okay. Now you hold it. There's one fissure.
This is bilobe, no, sir?
Two lobes. Okay. Now, this is the place for the heart. Okay. This is the diaphragmatic surface. Now, okay. Now, you imagine, see the pleura is attached here. Who injured this? See, this is the pleura, this shining glossy surface. This is the thin layer. Okay, it is coming like this, and then in the root of the lung, hilum, it is here. This is the pleural membrane.
Yes.
Huh? Okay, now you see, you place it like this. Now see, it is like this, it is like this. Okay, I'll just show you the impressions now. See, this is posterior is rounded, because see the thoracic cavity is this thing. In this level, in this, it is from the portion of the vertebra and the ribs. These margins, costal impression. Costal impression. This will be on the lateral side, both right lateral, left lateral. Okay, rounded border, anterior sharp border. Anterior sharp border, posterior rounded border. It is in the thoracic cage, naturally. This is a small lung, left lung. Okay. Now, if you take it like this, it goes like this. See, it is in this apex. Apex. Okay. This is the base. The base. These impressions are. এই উঠে এসো এসো, এই এসো পাঁচজন এসো, আজকে তো কম আছে। These are the costal impression. Okay, then the costa is, the pleura is covered. This forms the diaphragm is here, separating the thoracic cavity from the abdominal cavity. Clear? Okay, this is the space for the heart. This is the lingula. This is the anterior sharp border, the posterior rounded border, and this is the base, the sharp border. Okay. Now this is the part and the structures going through the your hilum. One thing you do is now you take out your book, see it. Individually একদম পড়ে নাও। এখন ধরো 12:30 কটা বাজে? 12টা। 1 hour, 45 minutes. You take 45 minutes. Intensively you study. And what are the structures going through the hilum? No. Which artery supply and basic. হ্যাঁ, এটা তোমরা নিজেরা দেখবে, ওখানে আমি প্লেস করে দিচ্ছি।